BlueSkyBio's newest digital product is BlueSkyMonitoring. BlueSkyMonitoring allows you to monitor your aligner patient's teeth movement remotely. The patient uses the monitoring app on their cell phone, connecting to a monitoring scope that can be printed directly or ordered to take photos and video scans of their teeth that show up directly in your clinical remote monitoring patient dashboard. BlueSkyMonitoring is currently being offered at no charge. Let's just clarify a few terms and brands. BlueSkyMonitoring is, of course, the dentist's clinical platform for remote monitoring. However, patients should not be interacting with BlueSkyBio. Of course, BlueSkyBio is a dental implant company developing innovative dental products and dental digital products, and a patient should not be going to BlueSkyBio.com and should not be interacting with the BlueSkyBio brand. Therefore, we've created iSmile Teledentistry. iSmile Teledentistry is an app available on the Apple App Store and on the Google Play Store, where the patient could go ahead and download this app and use the app for relevant patient functionality. Currently, the iSmile Teledentistry app could be used for iSmile simulation and iSmile monitoring. iSmile simulation is, of course, the ability for the patient to take a photo of their face, and within less than a minute, at no charge, they will receive the same photo returned to them with a perfect smile. iSmile monitoring is exactly what we're talking about now. iSmile monitoring is the functionality in the iSmile Teledentistry app, where the patient will receive the scan requests and messages directly from you. They will photograph and scan their teeth accordingly, and the photo and the scans will be sent directly to your BlueSkyMonitoring platform. The scopes to which they attach their cell phone will be given to them by you, the dentist. You are able to print the scopes directly after downloading the STL files free of charge, or you can order the scopes for BlueSkyBio. A single scope costs $24, but bundles of 10, 20, 30 drop the price per scope accordingly, and a bundle of 30 scopes comes out to a bit over $13 a scope. We do offer the scopes at no charge when ordering a complete aligner case package from Lab Pronto. Starts at $4.99 for up to 24 aligners, $7.99 for up to 80 total aligners, and $9.99 for unlimited. A free remote monitoring scope is also, of course, included in our BlueSkyMonitoring project, where you have a mentor on your shoulder throughout the entire aligner treatment. That's a topic for a different video. Not going to get into that right now, but you could check out more information at BlueSkyAligners.com. Okay, what's great about getting started with BlueSkyMonitoring and the BlueSkyBio digital suite in general is if you have an account for any of our digital products such as Lab Pronto, Bio Big Box, BlueSkyMeet, then of course you already have an account for BlueSkyMonitoring as well. If you don't yet have an account, then signing up is free, super simple and quick. You could use your Google ID, you could use your Apple ID, you could sign in via your cell phone and a verification code, many different options about signing in. Of course, gives you access to all of our BlueSkyBio digital products that you could see here, and for more information, you could see at BlueSkyBio.digital. Okay, when you log into BlueSkyMonitoring.com for the first time, this is what you will see. The button here, Learn About BlueSkyMonitoring, will take you to training tutorials, as well as additional information regarding the scopes, downloading the STL files, or ordering the scopes from BlueSkyBio. To get started, click Add Patient. Simply enter the patient's information. It's important that you enter an accurate phone number and email, as the patient will be receiving notifications such as downloading the app, change their liners, and to perform the requested scans. Okay, I've entered information for a fictitious patient, Sky Blue. Enter any sort of description, free text field you like, and then go ahead and click on Next. At this point, we're now going to create a treatment. So we automatically populate the field with the patient's name, and then we just add the words aligner treatment. The idea being that the patient is undergoing an aligner treatment. If you'd like to change the name in any way, then just go ahead and enter it. The category, of course, is orthodontics. The product that we're dealing with is aligners. And the start date will be the date that the patient is starting to wear aligners. By default, it's set to the date that you create the treatment. If needed, you could change accordingly. Ask for fit rating on aligner change means that the patient will be prompted to select an option about how the new aligners fit in their mouth when they put their new aligners in their mouth. Enter number of aligner sets and aligner change frequency. So let's put in 20 aligner sets and let's select bi-weekly. Go ahead and click on next. And at this point, we're up to the request scan stage, which means that we're going to create a schedule for the patient throughout their treatment. You'll be able to edit it if necessary, but we're creating a schedule of scans that will be requested from the patient during their aligner treatment. The scan requests are being based on when they will be changing their aligners. So you're able to select a number of days and if it's before their aligner change or after their aligner change. Now we've pre-populated this screen. So if you like to keep the options on screen, then just go ahead and click on finish and it will do everything for you. So you don't need to make any changes to the screen. You could select the default options, which currently the default options are 0 days before an aligner change, which means on the date of the aligner change. We're requesting a scan. The scan consists of a video with them moving the scope horizontally with their mouth closed with their previous aligners, and another video with the scope moving horizontally and their mouth closed with the next aligners. So when they're performing the scan via the iSmile app, they'll be prompted exactly what to do. They'll be prompted to stop the scan, take out their aligners, put their next aligners in, and scan with their next aligners. Now, of course, you're able to make changes. You could select if you want an image, photo, or if you want a video. You're able to select if the scan should be done horizontally, meaning the scope is moving side to side, or if the scope is moving vertically up and down. You could select the mouth position if you want it closed or open, and with their current aligner, their next aligner, their previous aligner, or with no aligners. So we have full options of customizing what the scan request is. And if you like, for every aligner change, you could request multiple scan requests. So you could have X number of days before an aligner change. And in addition, you'd press the plus here, create another scan request. That would be X number of days after an aligner change. So this screen is on one hand fully customizable. On the other hand, if you don't need to make any changes, you could just go ahead and click the finish button. The button that we have here, skip and create treatment, means that there isn't going to be a schedule of scan requests created. It means that you'll be able to request a scan whenever you want to request a scan. You'll see that you'll have a button to add a scan request, and then you would manually add the scan requests. So again, if you want the schedule created, and we'll take a look at that now, then you'll just click the finish button. If you want to move ahead without creating any scan request schedule, then just click skip and create treatment. For now, we're going to click on finish. So now what has happened is that the system has created a full schedule for this patient's aligner treatment that consists of prompting the user to change their aligners when they need to change and requesting the relevant scans. So if we look at this screen a little bit more in detail, on the left-hand side, we have the patient's name. Of course, when you have more of your patients added, they'll show up in a list. Now, if everything's okay with this patient and they're up to date, then they show up with a green frame around it. If they're late and they didn't perform the relevant scan or they didn't change their aligners when they were supposed to, then they're going to show up with a red frame indicating that something from their side is overdue. Now, if they've done everything they're supposed to do and they perform the scans correctly, then they're going to show up with a blue frame pending your review of the scan. Once you review the scan, then they'll change from blue back to green for being up to date. Now, of course, you could see the patient, their contact information, the details about the treatment, what stage of the treatment they're up to, how often they're going to be changing their aligners, when the next scan is scheduled, and when the next aligner change is scheduled. Now, if we take a look at the schedule itself, we could see that the so-called aligner change is for today's date, and it's telling the user to use aligner 1. In 2 weeks from now, the user will be prompted to switch their aligners. They'll be able to confirm, and they're going to have a scan request as well. And we can see the 2 scans that are requested are the 2 scans that were created when we created the schedule. The patient will also be prompted to notify about how the new aligners fit in their mouth, and that will show up automatically in fit rating. If you would like, and for whatever reason the patient didn't submit that, then you could manually add the fit rating yourself. As the treatment progresses, then of course the percentage of the completed treatment and the current aligner and all the information will update automatically. What we're currently looking at is the entire schedule for the treatments. If we want to see just the scan requests, then we could click on scans. And if we want to see just messages that you've sent or received to the patient, then you would go to the messages section. Once a patient performs a scan, then of course you will receive a notification. And of course there will be a big button here that says view scans. You'll be able to click on the button and you will see the photos and the videos that are submitted by the patient. At this point, when we created the patient, the treatment, and the schedule, the patient has received a text notification as well as an email prompting them and giving them very simple instructions to download the iSmile Teledentistry app. When the relevant dates for the aligner change and for the scan requests approach accordingly, the patient will receive the relevant notifications to perform the scans, and they'll be taken through a step-by-step tutorial via the iSmile Teledentistry app exactly what to do. Now, things don't always go exactly as scheduled, and a scan might be performed a little bit late, or the liner change might be performed a little bit late. So we have the option here to edit any of what we call milestones in the treatment. So if a scan request date needs to be edited, or the type of scan, or the liner date, then all of that could be done accordingly. We also have the ability to add a milestone. Currently, that's the ability to add a scan request. So for example, if you want to request a single additional scan, for example, do a trial scan with the patient, or because you chose the option to skip creating scanning schedule and you just want to request a scan each time. So either way, then again, you could go to add a milestone and click scan request. You have the option of setting it for a particular date or in relationship to a particular liner change. Once again, you could define what type of scans should be within the scan request, and then you would simply click the add button. So if I go ahead and do this now, I could set today's date. If I want to do a sample scan with a new patient who's coming to my office, for example, and want to make sure that they know how to use it correctly, I can add an additional scan request and click add. Okay, we can see that the new scan request has been added to the schedule, and of course the patient gets the relevant notifications in order to go ahead and perform the scan. Just to clarify, if you're changing the date of an existing scan, then you'll simply go to the relevant scan request and click the edit button. What we just performed by adding a milestone is to request an additional scan. Okay, so I currently have my camera on and I'm showing you the screen of my phone so I could show the patient side of things a bit. So before we get started with performing the actual scan, these are the pieces of the scope. Now what's great about it, and the reason I have it in 2 different colors here, is I actually tested printing it on multiple different printers. And even pretty basic printers such as the Robox printer, had good quality prints that could be used. And definitely printers like SprintRay and many others are fantastic printers to go ahead and print out the scope on. Now, of course, if you're doing a larger quantity, or if you just don't have a printer, that's fine. You could go ahead and order the scopes from BlueSkyBio. And as I mentioned earlier, if you're placing your Lab Pronto order, you're going to get the scope for each case for free. So assembling the scope is super simple. Okay, the best way to do it is on a flat surface. But basically, you just put the bottom piece on the flat surface, and then you just click the top piece in. So now you have the scope. Now, what we recommend doing, and when the patient is doing this, we have a step-by-step process flow on the app that they're prompted to do, is basically to put the camera in the middle of the scope. Turn the camera on, make sure you have your camera lined up in the middle of the scope, and then to count the number of ridges from the bottom where the bottom of the phone is positioning. And then really simply You put a band that comes with the scope, or if you're printing your own, you simply insert the band into that ridge and you're going to wrap the phone into place. It's a good idea to do this above a table and not when a patient is standing and there's a higher drop above the floor. So if you're doing it, if a patient is doing it, if you're doing it, then it's a good idea to do it on top of a table. You put the phone into place and you simply wrap the band around the phone and you're good to go. Now, what we could see, let's get that connection back. Okay, now we can see things, what the notifications, etc. the patient gets. So the first time when you create the schedule for the scan requests, or the first time you send the scan request, the patient gets prompted to download the app and they have the direct link to go ahead and do so, and they can download the app from the app stores. After that, anytime there's a scan scheduled or requested, then they simply get a link. When they click on the link, then it brings them directly into the app to perform the relevant scan. So let's take a look at that a second. Okay, so the patient gets a link that the doctor, the doctor, are requesting a new scan. They click on the link. If it's the first time they're using the app, then they're going to log in. They click Start iSmile Monitoring. Of course, you and the patient could use the simulation functionality if you like, but let's do iSmile Monitoring. And signing in is super simple. They enter their cell phone number. They get the verification code sent to them immediately, 70 80 67. Enter the verification code, 70 80 67. And now they're going to stay logged in once they're logged into the monitoring system. So this is what the screen looks like to them. They have their whole schedule of aligner changes and scan requests. And it says exactly when each one is scheduled for. The one that's scheduled for today is, of course, active. They click on the button View Scanning Requests List, and they see the 2 scans that were requested by you, the dentist. Now they're being led through a very short wizard. If they've scanned already, if this is their 10th scan, they know exactly what they're doing. They could just click Skip to start scan, and it takes them exactly to start the scan. Otherwise, they go through a very short wizard. They click on Next. It shows the patient how to assemble the scope. Click on Next to position the camera in the middle of the scope. It's going to look a little weird as I'm trying to do this in front of my screen as well. Let's do it this way. And they still have the entire time the option to skip to start scan. Go ahead and click on Next. Now that the camera of the phone is positioned in the middle of the scope, count the number of ridges, 1, 2, 3, 4. We're dealing with the 4th. And of course, it will always be the same number of ridges. So they make a note that if for them it's ridge number whatever. Then it tells them to put the band in, just as we mentioned earlier, into the relevant ridge. And then to simply wrap up their phone into the correct position. Okay. Once that's done, here we are. It's very solid, secure. They go ahead and click on Next. Okay, so an important point here is that the patient should be facing the mirror with their head straight the entire time, and essentially what's going to be moving is the scope with the phone either side to side or up and down or center, depending on the scan request. So I'll go ahead and I'll perform this, and obviously I won't be able to talk during that. So this is once the positioning has been done. This is just a last confirmation the positioning is okay, to make any small adjustments necessary, and to zoom in as well. Okay, click Next. Now, obviously, it's backwards because the patient is going to be standing in front of the mirror, and when they put their device in their mouth, then they're going to be seeing the text through the mirror.
Confirm that your previous aligners are in your mouth. Bite down very gently. Face forward, towards the mirror the entire time. Follow the on-screen prompt.
Okay, now the patient is being prompted to switch their aligners because the scan request was for the previous aligner and the next aligner. So they go ahead, they take their aligner out, they put their next aligner in, they click resume.
Your next aligners are in your mouth. Bite down very.
Okay, now it tells them they finished, simple as that. And now the scans are being sent to you, the dentist. Okay, scans have been transferred successfully. You may now close the app. You, the dentist, of course, receive notifications that the scan has been complete. We can see the patient now has a blue frame around him as it's pending review by you, the dentist. If you go and click on View Scans, then the two scans appear on screen. You could toggle from one to the other. And of course, in my situation, I scanned without aligners, but if the patient's doing it correctly and they have aligners, then one scan will be with the previous aligners, and the next scan will be with their next aligner. And once you've finished viewing the scan, you could close the View Scan box and return to your clinical dashboard to view other patients and to view other scans.